Ma'am, police, I need to speak with you about this medical call.
Officer, I'm handling a medical emergency right now. What's the issue? Here's my EMT license and medical certification. I need to get back to my patient.
Kenya Williams.
Kenya Williams was met with suspicion from patient family members when she went on a routine 911 call that afternoon. The medical team arriving with the Metro Medical Ambulance was accused of being fake personnel. When Officer Rodriguez arrived at the scene, he had to balance an ongoing emergency medical response with a police investigation. Tonight, we'll examine how an EMT was deemed suspicious during an emergency call and how emergency medical response intersects with law enforcement. If you follow this type of real emergency response analysis, please subscribe and turn on notifications. These stories contain important lessons about the challenges faced by medical professionals and emergency protocols. Kenya Williams, 31 years old, an experienced EMT born in Dallas. Before deciding to become an emergency medical technician, she tried different career paths. She started nursing school but had to leave it unfinished due to financial reasons. But she didn't give up on the medical field, enrolling in an EMT certification program. Becoming an EMT isn't easy. Intensive training program, medical emergency scenarios, CPR certification, pharmacology basics, trauma response. Kenya successfully completed every stage. She had a passion for emergency medicine and wanted to save people's lives. After graduation, she applied to Metro Medical Service, one of the largest ambulance service providers in the Dallas metropolitan area. Kenya passed the competitive application process, completed her field training, and finally became a full EMT. Her career beginning at Metro Medical Service was challenging. Night shifts, stressful emergencies, difficult patients, emotional reactions from family members. Kenya displayed a professional approach to every situation and developed her medical expertise. Within 3 years, Kenya became an experienced EMT. Cardiac emergencies, trauma cases, psychiatric emergencies, pediatric calls, she dealt with every type of medical situation. Her colleagues respected her, supervisors trusted Kenya's reliability. Kenya's work ethic was perfect. Always on time, careful about equipment maintenance, compassionate in patient care. She participated in medical continuing education, quickly learning new protocols. Diversity is important in the emergency medical field. You serve different communities, work with patients from various backgrounds. Kenya found this diversity valuable, believing that different perspectives improve patient care. That Thursday afternoon, Kenya started the 4 p.m. to 12 a.m. shift with her partner Mike Johnson. Mike was a 45-year-old experienced EMT who had mentored Kenya. They formed a good team, providing smooth coordination in emergency situations. At 4:15 p.m., the first call came in. Chest pain, 67-year-old male, difficulty breathing, Oak Street 1425. High priority call with possible cardiac emergency. Kenya and Mike immediately responded, driving the ambulance in emergency mode. Oak Street was a middle-class residential area. Single-family homes, retired couples, working families, mixed demographics. Kenya had gone to emergency calls in this neighborhood before and had generally encountered cooperative residents. Upon arrival at 1425 Oak Street, Kenya followed standard protocol. She prepared her medical equipment bag, oxygen tank, and cardiac monitor. Mike parked the ambulance, keeping the emergency lights active. Normal emergency response procedure. An elderly woman opened the front door of the house. "Please hurry, it's my husband Robert. He's having chest pain and can't breathe properly." Mrs. Dorothy Peterson, 64, was in visible distress. Kenya responded in a reassuring voice, "Ma'am, we're here to help. Where is your husband?" Robert Peterson was sitting in a recliner chair in the living room, in obvious distress. Chest pain, shortness of breath, sweating, classic cardiac symptoms. Kenya immediately began assessment while Mike prepared the equipment. "Mr. Peterson, I'm Kenya from Metro Medical. Can you describe your pain?" Kenya displayed a professional medical approach. She began vital signs check, oxygen saturation measurement, and cardiac rhythm monitoring. During this time, Mrs. Peterson was nervous but cooperative. She explained her husband's medical history and listed his current medications. Kenya noted the medical information and developed an appropriate treatment plan. During the assessment, neighbor Mrs. Sarah Mitchell was observing the situation. A 58-year-old retired teacher who had been living on Oak Street for 15 years. In recent months, some scams had been reported in the neighborhood, with fake service workers going door to door. Mrs. Mitchell had never seen Kenya before. Young black woman, professional appearance, but unfamiliar face. Emergency vehicles were sometimes targets of scammers. Fake EMTs might attempt to steal valuables. While Kenya continued medical protocols, Mrs. Mitchell felt increasing concern. Could she check EMT credentials? How can you verify legitimate medical personnel during an emergency? Confusion and suspicion were growing. At 4:35 p.m., Mrs. Mitchell called 911. "Hello, I want to report suspicious activity. There's an ambulance at my neighbor's house, but I'm not sure if the EMT is legitimate. Young woman, haven't seen her before. Can you verify?" The 911 operator asked standard questions. Mrs. Mitchell explained. She was observing an emergency call. The EMT was unfamiliar, requesting verification. The operator forwarded the situation to police dispatch. Police dispatch gave Officer Rodriguez the assignment. Oak Street 1425, verify legitimacy of EMT personnel, neighbor complaint about suspicious medical worker. Rodriguez was an 8-year experienced officer, familiar with medical emergency calls. The body cam footage you watched earlier shows the moment Officer Rodriguez approached Kenya. Rodriguez was arriving at the emergency scene, observing the ongoing medical situation. While Kenya was providing legitimate medical care, a police inquiry was beginning. "Ma'am, police, I need to speak with you about this medical call." The approach was professional, but the timing was problematic. Kenya was in the middle of patient assessment. Emergency treatment was the priority. Rodriguez understood the delicacy of the situation. "Officer, I'm handling a medical emergency right now. What's the issue?" Kenya's response was calm but urgent. She couldn't discontinue patient care, but police cooperation was necessary. A difficult balance between medical priority and law enforcement inquiry. Similar situations occasionally occur in the emergency medical field. EMT identity verification, credential checks, suspicious activity reports. Kenya had covered these scenarios in training, but real-life implementation was challenging. Rodriguez was displaying a professional approach. Investigation was necessary, but the medical emergency must be respected. "I got a call questioning if you're a legitimate medical professional." The explanation was reasonable. Kenya understood. "I'm a certified EMT with Metro Medical. My credentials are right here on my uniform." Kenya's response was factual. EMT patches, name badge, medical equipment, everything indicated legitimacy. Rodriguez could do visual verification. In the continuation of the body cam footage, Rodriguez examined Kenya's credentials. EMT license, Metro Medical ID, medical certification with current expiration dates. Everything verified her as a legitimate medical professional. During this time, monitoring of Robert Peterson's condition continued. Blood pressure elevated, heart rhythm irregular but stable. Kenya was completing the medical assessment while simultaneously handling police verification. Kenya Williams, certified EMT, Metro Medical Service. "Who called about you being here?" Rodriguez continued the professional inquiry. A legitimate investigation, but not interrupting the medical emergency. At this point, Kenya was frustrated but understanding. "I don't know, officer. We responded to a 911 call for chest pain. This is a legitimate medical emergency." She was balancing patient advocacy with law enforcement cooperation. Mike Johnson was observing this conversation. As her partner, he was ready to support Kenya, but didn't want to confront police interference. He maintained a professional EMT approach. Mrs. Peterson was worried about her husband's treatment being delayed. "Officer, please, my husband needs medical attention. Can this wait?" Family member advocacy was requesting priority for patient care. Rodriguez was realizing the complexity of the situation. A legitimate medical emergency was ongoing. A certified EMT had provided legitimate credentials, but he had to investigate the neighbor complaint. Decision point: continue the investigation or respect medical priority. "How long have you been working for Metro Medical? This equipment all yours." Rodriguez was trying to complete verification. He was checking medical equipment, ambulance credentials, employment history. Kenya was approaching her patient's limit. 3 years with Metro Medical. "Officer, my patient needs immediate attention. Can we do this after?" Medical priority assertion was a reasonable request. At this moment, Rodriguez made a professional decision. He recognized the priority of the emergency medical situation, modifying the investigation. Kenya's credentials had provided sufficient verification. "Ma'am, your credentials check out. Continue with your patient care. I'll follow up with dispatch." Rodriguez provided a professional resolution, not interrupting the medical emergency. Kenya was grateful but focused. "Thank you, officer. We need to transport Mr. Peterson to the hospital." Medical priority resumed, patient care continued. Robert Peterson's condition was stable, but hospital transport was necessary. Kenya and Mike transferred the patient to the ambulance, maintained cardiac monitoring, and prepared for departure to the hospital. Mrs. Peterson was grateful to Kenya. "Thank you for taking care of Robert, despite the interruption. You're very professional." The patient's family was expressing appreciation for the quality of emergency medical care. After the ambulance departure, Rodriguez had a conversation with Mrs. Mitchell. He understood the neighbor's concern, but explained that it was a false alarm. The EMT was legitimate, the medical emergency was genuine. Mrs. Mitchell was apologetic. "I was trying to protect my neighbors. Recent scams made me suspicious of unfamiliar service workers. I didn't mean to interrupt medical care." Good intentions but misplaced suspicion. Rodriguez took an educational approach. "Ma'am, if you have concerns about emergency personnel, call dispatch for verification but avoid interrupting medical care. EMTs have identification and can be verified quickly." This incident was a learning experience for Kenya. The possibility of police inquiry exists in emergency situations. Maintaining a professional response is important. Medical credentials should always be readily available. Metro Medical Service reviewed this incident. They discussed EMT personnel identification protocols, police interaction training, community relations improvement areas. Kenya's professional handling was commended. Supervisor Linda Martinez had a follow-up meeting with Kenya. "Kenya, you handled a difficult situation professionally. Balancing patient care with police inquiry is challenging, but you maintain medical priority correctly." Kenya emerged strengthened from the incident. "It was unexpected, but training prepared me. Patient care is always priority, but cooperation with law enforcement is also important when appropriate." Officer Rodriguez wrote a report. "EMT personnel legitimate and professional. Neighbor concern unfounded, but reasonable given recent scam activity. No further investigation necessary." It became a reference for similar incidents in the department. Mrs. Mitchell was impressed by Kenya's professionalism. Later, she called Metro Medical Service to give positive feedback for the EMT's performance. Kenya was excellent despite the difficult circumstances. Robert Peterson received successful treatment at the hospital. The cardiac episode was minor, medication adjustment was sufficient. Kenya's quick assessment and professional care contributed to recovery. This experience created discussion in the neighborhood. How to verify emergency personnel legitimacy without interfering with medical care. Community education was necessary to understand emergency protocols. Metro Medical Service started a community outreach program. EMT identification, emergency response protocols, when to call for police verification. Public education to recognize legitimate emergency workers. Kenya began evaluating advancement opportunities in her career. She was considering paramedic certification to develop advanced medical skills. The incident increased her confidence regarding her professional abilities. 6 months later, Kenya was accepted into a paramedic program. She would receive authorization for advanced life support, medication administration, and complex medical procedures. A natural step in career progression. Mrs. Mitchell became a community advocate for emergency medical services. She gave presentations to the neighborhood watch group and organized training to recognize legitimate versus suspicious activity. Officer Rodriguez developed a more nuanced approach to similar incidents. He learned the balance of completing investigations while respecting medical priority in interactions with emergency medical personnel. This story highlights the daily challenges of medical professionals. Additional stress factors in emergency situations can create unexpected complications. Professional training is essential to handle these scenarios. Community awareness is important to understand how emergency services function. Making distinctions between legitimate concern and unnecessary interference is critical for patient care quality. Kenya's experience represents typical challenges in the emergency medical field. Professional medical workers occasionally face scrutiny, suspicion, and verification requests. Training and professionalism are necessary to navigate these situations. EMT work is a demanding career. Life and death decisions, stressful environments, emotional situations. Public support and understanding significantly impact the job performance of medical professionals. I want to ask you, if you have concerns about service personnel verification in emergency situations, how would you handle it? Is it possible to make appropriate inquiries without interrupting patient care? This case study is used in emergency medical services training programs. It provides examples of police-medical interaction, community relations, and professional communication. Kenyon now works as a paramedic, serving patients with advanced medical capabilities. She applies the lessons learned from the incident in her daily practice. Mrs. Mitchell became an advocate for emergency services, participating in community education programs. She balances preventing false alarms while maintaining legitimate security concerns. Officer Rodriguez received additional training on medical emergency protocols and improved professional interaction with healthcare workers. He shares this experience in the department for training purposes. Metro Medical Service strengthened community relations. They expanded public education, identification protocols, and emergency response awareness programs, improving EMT recognition for community cooperation. Lessons from this story: medical emergency priority should always be maintained. Professional credentials should be readily available. Community education is important to recognize emergency services. Police medical cooperation is possible with appropriate timing balance. Communication is key for conflict resolution between all parties. Emergency medical services are the community's lifeline. EMTs, paramedics, and emergency physicians provide life-saving care on a 24/7 basis. Public support and understanding improve the effectiveness of these services. I'm curious in the comments, how have your experiences with emergency medical personnel been? Have you observed similar situations? What can be done to support community emergency services? If you want to follow this type of emergency response analyses, don't forget to subscribe. Medical professionals' experiences, emergency protocols, and community relations are explored in these stories. Kenya's story continues as a paramedic. Advanced medical skills, leadership responsibilities, active participation in community relations. The incident strengthened her professionalism for career development. We will continue to examine real experiences of healthcare workers on this channel. Emergency medical services, hospital personnel, public health workers, all of their stories are important to understand society's function. Healthcare heroes face challenging situations on a daily basis. Recognizing and supporting their dedication, professionalism, and public service commitment is all our responsibility.